A new research project in Regina is using geodata on discarded needles and pop-up testing sites for sexually transmitted infections to improve health care access and reduce our province's high rates of HIV, hepatitis C, and syphilis. The project is a partnership between AIDS Program South Saskatchewan and the University of Regina. A 2024 Public Health Agency of Canada report revealed that Saskatchewan still has the worst rate of HIV infections in Canada in 2023. We also have some of the country's highest rates of hepatitis C and syphilis. It was in 2023 that third-party sexual health educators were also banned from our province's schools. So what is the status of sexual health care in our province? Today we're going to check in with Saskatoon Sexual Health and Planned Parenthood Regina. We'll also learn about a website that our health authority has populated with all kinds of resources. And we also want to hear from you. Have you been able to access sexual health care services? Where are you finding gaps? And if you have questions, what do you need answers about? We'll try to get that for you today. Call 1-800-716-2221 or send us an email, bluesky@cbc.ca. Now, as I mentioned, a project in Regina is using a new outreach approach to get more people tested for STIs. It is a collaboration between AIDS Program South Saskatchewan and the U of R. Project researchers say it's the first study of its kind in the country. Researchers map out where discarded needles are commonly found, and then they bring up pop-up testing to those hotspots. One of those pop-ups is actually happening today, right now, in fact, in Regina. Shawnee Mary Verghese is the executive director of AIDS Programs South Saskatchewan.
Saskatchewan has got the highest HIV rates in the country, and now also syphilis rates have increased also. So we're trying to combat all these viruses. It wasn't any research at that time. It was just an idea that we had, if we that these they've mapped it, so we're looking at the hotspots. So if we go into these hotspots, whether we would be able to have some kind of impact on people. So, and at that time we were looking at naloxone training, given because of the drug toxicity at that time, we were looking at trying to see whether if we almost like flood, the areas with naloxone, whether that'll help. So, we started with that. That was our first project, and then we had another. We started with that, and then there was another one, and now we are with the CIHR grant. So this one is with the HIV, Hep C, and syphilis. So we have a nurse coming, and we have also a nurse who's at and a lab technician who's at the pop-up events, along with our education team. And so they do the education first, and then and there's a pre-survey, and then after that, then they do the testing, and then there's a post-survey also, and then a week later there is an interview to see how they are, to get feedback on the pop-up event. How it went. So we're hoping that there will be some kind of an impact, when we are doing both the education as well as the testing, that people will know their status, and they're more educated. Knowledge is power. So then they'll be more educated, and they'll be careful about how they are, what activities that they're doing. We are in a situation where we don't have, let's say, food, or we are looking for something else, and that's going to be more our priority rather than going and getting tested, right? So so just basic needs, maybe even housing, so we have our peers who are also at the pop-up, along with our education and research specialists. And so they provide all that education, and then they pass them along to the research assistant, and then finally to the nurses to do the testing. So here we are going to them, wherever they are at that particular area. We are going to them, and we're making it much more easier, because about 99% of the people who come into our exchange, our needle exchange, do not have means of transportation. So they're not like let's say you and I, who can just maybe go and get drive from A to B as quickly as possible. So rather than them making that effort, we are making that effort to go there and get them, give them that education as well as the testing.
Shawnee Mary Verghese is the Executive Director of AIDS Programs South Saskatchewan. Today we are talking about the status of sexual health education and care in Saskatchewan. And my main guests this hour are Julian Weatherspoon. She's the Executive Director at Planned Parenthood Regina. Welcome to Blue Sky.
Thank you.
And Saskatoon Sexual Health, who is staying booked and busy. They say this year is shaping up to be a record-setting one compared to last year. And Candace Klein is the executive director there at Saskatoon Sexual Health. She joins us now. Welcome to Blue Sky.
Thanks so much for having me. I appreciate it.
So listening to Shawnee there, both of you were nodding along. Julian, as you're listening to her talk about this pop-up testing site, what really stood out to you?
To me, it's always those social determinants of health. I think that she did a really good job of talking about that we can't really talk about sexual health in a vacuum. We need to talk about it in the context of the realities of people's lives and the realities that people are facing. And our colleagues over at AIDS Program South Saskatchewan, have a different clientele that we do, but the same mission and the same goals, but we're all sort of coming up against those external things that we kind of don't have control over. But it's really hard for people to pay attention to their sexual health if they're primarily worried about the security of their housing or being able to get to work or manage childcare and all of those other things.
Candace, it sounds like what Julian said too, in a way, is that we take our sexual health for granted until it's a problem, is kind of what I heard there. Why is sexual health important to our overall health?
Well, sexual health is very much a part of primary care and primary health. We have to think of the body as a whole, functioning as a whole. And, things like hormones, reproductive health, sexual health, those all play pretty immensely into not just our physical health, but our psychological health as well, right? It's sort of that mind-body system that we like to think about in connection with one another. And it's a part of primary care. Sexual and reproductive health are very much a part of your yearly checkup, or at least it very much should be, because it really does affect us all in so many different ways, in different levels.
Can you give me some examples of how it affects us? And I'm not saying specifically take housing security out of it, or take the fact that everything is so expensive out of it. But give me some examples of how that health can impact us on a day-to-day basis that maybe even people don't realize that, oh, this could be that.
Right. So, for example, just your mental health and anxiety. Perhaps you have something happening in your reproductive area. You're not sure what's going on. That can really just affect your everyday mental stability, your ability to interact with one another to get things done. But ultimately, it really is just this underlying function. And for example, things like birth control are really important. Folks who are getting IUDs insertions, you have to make sure that you talk with your nurse practitioner or your doctor, because there can be complications from that. And it can severely affect your life in really important ways. It can actually affect your functioning, for example. So that in itself is something that's really important. And, IUD services are one of our top services that we do. And there are occasional complications, and that really can be a big deal. But also even the ability to have control and autonomy over your body is really important for folks in everyday life and making their decisions. And it's a part of those sort of larger life decisions as well, right? And so that's sort of what I'm talking about with that primary health care, right?
Have either of you seen an increase in patients, clientele, as people continue to struggle finding a family doctor?
Yes, absolutely.
Say more.
Yeah.
Say more.
I
Yes.
mean, yes. And even people with family doctors, I think, are sort of choosing to come to clinics like ours as well, either because those family doctors aren't providing that full scale of sexual health care, or because of that stigma. Like, they just don't want to talk to their family practitioner about their sexual health. But absolutely, we have an increasing number of people calling, and an increasing number of people who, we try to offer as full scale services as we can, but there is a limit to what we can do. So even things like referrals, that people can't access a referral because they don't have a family doctor, is going up and up, and sort of taking up more of the requests and the phone calls that we get on a daily basis.
What kind of referrals, when you say referral, that you would need, that people are having trouble getting access to?
So anything from referrals to gynecology for, various reasons. Some of those complications that Candace mentioned from IUDs, or if it's a follow-up, say, from an abnormal PAP, or sort of any number of things. But even as much as, like, earlier this week, I sort of was covering the phones and people were saying they don't know how to access prenatal care. That's not something that we offer. But walk-ins won't offer it. They need a referral to get to an OBGYN. We don't have enough midwives. So it all sort of ties in.
Who are you serving, Candace, at Saskatoon Sexual Health? Who's your primary clientele?
Well, we serve mainly, 16 to 29 seems to be the majority of folks who come in, although we are all across the spectrum in terms of age, gender. It's not actually, people think, this is just a women's clinic. It's really not. We have over 40% who are men. And it's all really over the class spectrum. But the majority is definitely up to that age 29. So a lot of people who really, it is an important time in their life to really take control of their sexual and reproductive health, people who are wanting to explore options around choice, people who, want to take their lives seriously in all aspects. And we're really, proud of a lot of our clients that come in because they are young and because they're taking these really important steps for their future. And if they so choose to have a family, to make sure they're as healthy as possible to do so.
Do you have anything to add to that? You were nodding along, Julian.
Oh, yes to all of that. We also see, primarily a younger, obviously our priority focus is on youth. And so when we're thinking about accessibility in our own clinic, that's sort of who we're thinking about, making things most accessible to. But it's such an important, I think, time of people's lives. But also, I think when we start talking too much about, like, who does this affect, or who do we serve, or, the mention about women's clinic, that, like, makes my teeth on edge every time somebody describes Planned Parenthood as a women's clinic, because everybody has sexual health. Like, if you have a body, you have sexual health, and this affects you. And so that, I think, idea that this is sort of a niche or a speciality, like we say, it's a primary health service that people need to access for their overall health and wellness, not just at some times of their life for some specific things.
I know that you're primarily serving young adults and young teenagers, but I'm curious if each of you could share what your 5 most requested services are. Obviously, there's going to be cases that are more serious or require a higher level of intervention with doctors and such, but for the everyday, what are your 3 to 5 most popular requests for service from people who call in, regardless of who they are?
For sure. So definitely number 1 is STBBI testing, so sexually transmitted and bloodborne infection, so STIs. Testing and treatment is our number 1 service. It looks like, based on projections that I'm seeing so far with our clinic stats, we're going to be doing anywhere, my guess is around 6,000 this year alone in tests. We're more than halfway. We're over halfway there. Also, cervical cancer screenings, so PAPs, especially when we're dealing with issues around physicians and their own family physician. That is definitely the number one request for folks. Also, all forms of birth control, whether that's oral contraceptives or IUDs, that's definitely another one. And also, what is becoming increasingly popular is PrEP. So preventative HIV medication, essentially, and managing that for folks as well.
Tell me more about that.
Right. So it's essentially a pill that you take, and it prevents the transmission of HIV, essentially.
So is it a daily thing that you take before you're sexually active, or is it something that's prescribed and you take on a regular basis?
You take it on a regular basis. And so you can come see our nurse practitioner who does that. You can see your primary care physician, but a lot of folks don't necessarily maybe even know about that. So that's something that we really do tend to specialize in here at the clinic. It's really important to combat HIV in this province. It is extremely effective. And it is also incredibly cost effective for essentially, I think it's something like, every 200 people on PrEP, it saves $1 million. So, it just makes sense fiscally, but also for people's well-being and taking care of their health.
Is it a covered medication?
It is, yes. Yes.
So who would benefit most from taking that on a regular basis?
Well, folks who are sexually active, I think a lot of the marketing goes towards, men, but we're seeing an increase in HIV in women in this province. And so it's becoming even more important that anyone can actually go on the Sex Life Sask website that is through the SHA, as well as our website. You can take a quiz and see what your risk assessment is. You can read about that, and you can figure out if PrEP is right for you based on the kind of activity you're engaging in. But essentially, any kind of sexually active, or especially folks who might be intravenous drug users, things like that, definitely should look into PrEP.
So it's almost it's like birth control, but to prevent getting that virus. I didn't know that. I didn't even know that was something that was available. I am clearly not as in the loop about these things as I thought I was. What are your top requests, Julian, at Planned Parenthood?
Very similar. So the majority of what we do throughout the year is that STBBI testing, screening, treatment, answering questions, all of that. And then I would say the number 2 is absolutely birth control and long-term birth control. So IUDs, Nexplanon, it's a insert that goes in the arm. And those are things that it's sometimes harder to find a practitioner who does those things. And so we find that a majority of requests that we get for birth control are related to those longer term options.
How are the wait lists for IUD insertions at your clinics? Is this something that people have to wait a long time for?
I hate making promises because the second I make a promise, 1 million people are going to call. We try not to fill up our schedule more than a month out. We try to get people in as soon as possible. I know other clinics around the city are having 3, 6, 8 month waiting times for those kinds of procedures, and so we do what we can, but. Yeah, you won't get me to say something on the record because you can never promise.
Yeah, of course. What about you, Candace?
Well, I mean, it really depends on the season. Currently, I think it's just a few weeks at the moment, but it fluctuates depending on demand, although we are really seeing an increase in demand for all services across the board. So yeah, just like Julian, I don't want to be like, oh, it's just a month. And then, it's 2. But we really try to keep things down between 2 weeks to a month for booking out. Mm-hmm. Just to make sure that we can get folks in, and the privilege of leading this organization means that I can do things like, for example, we're really noticing the demand in cervical cancer screenings are just through the roof. So we're trying to figure out a day we're going to do like a Papalooza, where essentially we're just going to have a day. It's a walk-in. People can come in and we're going to get as many PAPs done as possible for that day to just try to really keep up with this demand that we're seeing.
I have to say, and this is going to be an overshare, but the difference between having cervical cancer screening done by a GP who doesn't do them very often, and having it done by a doctor or nurse practitioner who does them all the time is not even a comparable experience. When it comes to like pain and discomfort and awkward factor, it is, having gone through both, I can tell you that there is sometimes, I mean, unless you have some GP that does them all the time, but given the demands of the healthcare system right now, I feel like, not to hype up the clinics like yours where that's kind of your specialty, but man, what a difference they make. Okay, I want to talk about the state of busyness and a state of slowdown and why clinics like yours really do have to exist, but I'm going to take a brief pause because Jesse Anton is so patiently standing by with a quick update on what our newsroom is working on this hour. Hi, Jesse.
Hello, Sam, and we're following this hour. Premier Scott Moe is holding a news conference, and this is in response to China slapping a 75.8% tax on all Canadian canola imports. That temporary duty kicking in Thursday. So this is, of course, expected to have a major impact on Saskatchewan producers. So keeping an eye on that news conference, will bring you more at 1 o'clock. As well, Saskatoon police say charges are now laid in a hit and run in Saskatoon back in May. Now, police say their months-long investigation uncovered a man was hit by a city bus. And now that driver is charged with failing to stop after an accident. So we'll have more on these stories and much more in about half an hour.
Thanks, Jesse.
You're welcome.
That's the CBC's Jesse Anton. She'll be back at 1 o'clock with a full newscast for you, and you can read about those developing stories at cbc.ca/sask. Today on Blue Sky, we are talking about the status of sexual health and sexual health education in Saskatchewan. My guests are Julian Wotherspoon, who's with Planned Parenthood Regina, and Candace Klein, who is the Executive Director at Saskatoon Sexual Health. The whole impetus for this conversation, Candace, is that I read your news release about how you had the busiest year ever. It was absolutely record-setting for you. How busy are you?
We are through the roof. We're managing. We have an incredible team here. We can really get things done fast for very little. And so we've really been put to the stress test, essentially, every single one of our staff. But essentially, we serve anywhere from 6,500 to 9,000 people a year. And it looks like we're projected to serve at that top end this year. And really, we're really just trying to keep up with that demand, which is ever increasing. I mean, folks who come to our drop-in clinics, those drop-ins, we do them twice a week. And we have 3 drop-in clinics a week now. And they are usually booked full within the 5 minutes.
Oh, wow. Okay. Julian, you guys had a bit of a slowdown in July. What was behind that? What happened?
We did. As with a lot of healthcare, it was staffing. So we're onboarding new staff, giving a well-deserved break to other staff, and really sort of taking that minute to take a look at that increase in demand and sort of do that reflection about who we're serving and what we're prioritizing, and that kind of thing. And it's been really great, and we're slowly but surely opening back up again. So it's exciting, and hope to be back up at that 6,000 to 7,000 mark that we're sort of looking at for the year.
What would happen if clinics like yours did not exist?
Well, that's a really bleak.
I'm asking because
it's really bleak.
Because our healthcare system is so slammed right now, and it sounds like you are as well. But what would happen if you didn't go through the hoops of finding funding and grants to exist?
Well, I mean, everybody's healthcare gets more expensive, really, is what happens when you don't have that primary healthcare, when you don't have that public health investment, when you don't have a population that has the access and the tools and the knowledge that they need to take care of their health and the health of their family and their community. Healthcare gets more expensive. And I don't know. I'll let Candace say more about it, but that's the bottom line.
Yeah, absolutely. It absolutely gets more expensive for the taxpayers, for the province. And unfortunately, people pay with their lives. We're already seeing exponentially high rates of syphilis and HIV in this province, and hep C levels that we don't see in other provinces for many different reasons. But one of the things that we'll also see is an explosion of cervical cancers, because, it's great people need to get the HPV vaccination and all of that, but you do need to check up. There are folks who just are higher risk. Those checkups need to happen. We need to make sure that we find that cancer in its initial stages in order for it to actually be successful and make sure that people go on to live long lives. So even just that alone scares me, because PAP and cervical cancer screenings are not really easy to access. So our clinic alone, right, how many folks have we caught in those initial stages is quite a bit, especially over the 50 years we've been in operation. We're talking about tens of thousands of people. So that alone, but then of course, just the testing and the treatment, I'd just be so concerned for all of us in this province around STBBIs and what even more severe outbreaks look like. I mean, we have all these mini outbreaks that we actually deal with, we take care of, we work with other partner organizations to help with that. We can really help contain things quite fast. But without us fast acting, I'm concerned what that would really look like. And what we're really seeing and we're really concerned about too is congenital syphilis. It's not necessarily something that we deal with per se at the clinic, although we have, but unfortunately, there's some pretty severe complications with folks who are pregnant, who don't know that they are positive with syphilis, and those babies end up in the NICU, and there's all sorts of complications that can happen. So you're going to see a swell, not just with that, but you're going to see the ER surges from complications around those things. You're going to see wait times explode, urgent care centers. We really help contain at least several thousand people a year in Saskatchewan with just us alone, and us combined with Planned Parenthood Regina. I mean, we take care of a really solid proportion of the province.
Well, that was a terrifying answer. Thank you for that. Okay, you talked a lot about STBBIs. I want to bring in our next guest for a little stint here. While I was doing research for this show, trying to suss out what resources are easy to find for people, I stumbled across a new to me website, sexlifesask.ca. It's a comprehensive website put together by the Saskatchewan Health Authority. Honestly, we're pretty in the loop. So I was really surprised I didn't know about it. I asked my coworkers about it. Nobody knew about it. So I wanted to learn more. So here to share that information with us is Janice Seaback. She's the province's STBBI coordinator with the SHA. She's been listening in and joins us now. Welcome to Blue Sky, Janice.
Yes, thank you for having me.
Okay, first of all, this is a new acronym for some people, STBBI. Tell me about what it stands for and what the new grouping is.
Sure. So as Candace had mentioned earlier, sexually transmitted bloodborne infections. So we kind of group it together. Some people would call it STI and HIV, but sexually transmitted and bloodborne infections. So throughout this, we'll be referring to STBBIs.
Okay. So what's the biggest misconception these days around STBBIs, in your opinion?
So that's a great question. And certainly what I can tell you is that the information out there, many of our folks in Saskatchewan were seeking information from out of province. And so we wanted to design and build trust and confidence in Saskatchewan and build this new website to provide it to folks here locally.
So this is a way for people to not have to use the Google and get resources that aren't local and that kind of thing. How did you get into this work?
So I'm a registered nurse, and I have been in this space for most of my career. I've been a nurse for 30 years. And so with being part of the health region, the website came from the former Saskatoon health region in the health promotion team. And so I'm considered part of the content experts and support this website. And, it was in process for several years, like starting in 2018, with a few local stakeholders and with some talented creators and animation and original artwork, we have developed a new website for Saskatchewan.
So tell me everything about this website. You said it started in 2018. How did it come to be and when?
Sure. So sexlifesask.ca, so I think that's important to know, was live in August about 2020, and we soft launched it in October of that year. So it was ready to launch during the COVID pandemic portion to support the local Saskatchewan residents to access sexual health information because of the impact of, as you mentioned, STBBI trends have increased, and to shift health behaviors. So again, many folks were seeking information elsewhere, and with our stakeholders, which I can mention later, we've had a lot of positive feedback for the content and the design perspectives. So as mentioned, it grew from just being a former health region, going into when Sask Health Authority became one as the amalgamation. So SHA has led this initiative to provide a provincial website. So it's comprehensive information for clients, teachers, parents, providers, kind of all in one place. And you can actually find it on your computer, sexlifesask.ca, or on your mobile device. And basically, it's easy to remember, so people can access that anywhere in Saskatchewan.
Who came up with the web address? Like, there's brainstorming, and you have to figure out what it's going to be. So how did you settle on Sex Life Sask?
So the health promotion team, as well as many of our stakeholders, came up with many names. So we actually had to put forth names. And again, this is a collaborative working group from a variety of different agencies working on this. And so we had several to work with, but we wanted to pick something that was actually across all stages of life. We needed it catchy, and it needed to be short. And so basically, we came upon this, and over the years, and again, it's been 5 years since our soft launch, and that's probably why you haven't heard of it. But basically, it is part of our web links when we talk to social media, and SHA does any kind of stories that will tag it because of the information that's up on the website. So one place to look for everything.
Who is it? You said it was across all ages. Who is it really geared for? Who are you hoping goes into this website and really uses it?
That's a great question. And what I can tell you is sexual health is for everyone. And we had mentioned that earlier in this program, sexual health for all. And I think every stage of your life, sexual health resources will change. So I think it's going to tailor to many audiences. And, I see the gals nodding as well, is because depending on what you're going through or what resources you need, then you'll access it depending on that. And there's some great animation, there's some great videos, and so they did a lot of work with that, with original artwork, music, voiceovers, very colorful because there's 6 colorful tiles, or again, they're drop downs depending on if you're using your phone or your computer. So it showcases sexual health resources, and it's specific to Saskatchewan. So I think we need to be proud out loud and make sure everybody goes to take a look.
Janice, as the STBBI coordinator, what are you most concerned about or worried about when it comes to sexual health in Saskatchewan right now? As a nurse, what are you most worried about?
Wow, that's a great question and a loaded question today. So, what I can tell you from being in the space many years, I think there's a multitude, and I'm going to talk about 3. One is knowing the information and the accurate information and where to go. And so I think this is why, and I really appreciate you having the ability to showcase this online sexual health resource, because it's fun, it's interactive, and there's many stakeholders involved. So I think information is really important, because sometimes people come and say, well, I didn't know that, from being frontline for many years. The other one is getting testing. So I think as we expand testing throughout Saskatchewan, and this interactive website will actually have a spot on it where you can click, and it's an interactive map for sexual health clinics. So you can click on the logo and it opens up and you can find all the services. And I wish we had more than just the few dots that we have there. So we do need to expand services. So testing to where the people are and bringing that close to home and accessibility, because we heard about, individuals not being able to find that family physician. But you know what? People do access and are very creative in trying to find their testing. So I think that would be my third. And my last one is treatment. In order for us to continue to help with our rates, we need to support and contact trace and get the partners treated at the same time as our cases. And we need access to STI treatment And we mentioned, chlamydia, gonorrhea, and syphilis. Those are the treatable infections. But we also need to know where to go for HIV PrEP medications. As mentioned earlier in the show here today, is that you can actually go to the website and there's a pop-up list of where you can access those medications. And even though it's not treatment per se, it's prevention way to reduce HIV in the individuals who would like to take the medication. Yes.
Janice, 30 years as an RN, you've seen, I would bet, a lot, like probably a lot of things that you just wouldn't even talk about on the radio. But one of the things that we have seen, and we've talked so much about young people here, but we know that rates of STBBIs, I'm going to get the acronym right, are also higher among seniors. Particularly when they move into congregated living situations, whether they have lost a spouse, they're social. It's a different life and a different style. And in a lot of cases, they can't get pregnant. So they're not worried about babies, but they maybe should be more worried about the other things that can happen in an active sex life. Is this website good for seniors, or where would you refer seniors who are, feeling frisky, but maybe not feeling like they want to go to a Planned Parenthood or a sexual health center and talk to a young person about it?
Well, I think that's what the benefit of this sexlifesas.ca website might be, because it's the continuing of all the stages in your life to be able to access information, whether it's condoms, relationships, your body, or other resources all in one place. And so, you know what? I think it's very individualized. And I think you got a great point that sometimes individuals may not remember how to put a condom on. And so there is a great animated video to give you education. And so you don't need to go to your physician or your provider or read the box. Like, there is great videos and information for all ages on this website.
Oh, Lord, if I had to read a tiny box, I'm at the person who's now lifting my glasses to read anything tiny font. So I completely appreciate not wanting to have to read the fine print on anything. If people have questions, Janice, and maybe they're feeling uncomfortable to ask, who would you refer them to? I know the website's a great resource, but who would you suggest they call? Is this an 811 situation? Would you refer them to a clinic if it's a sexual health question? As a nurse, who would you refer them to if it's a sexual health question?
So particularly this website was intended to help all individuals. I meant the clients, teachers, providers as well, because it's all in one location. So if there are individuals who are looking for a speaker or workshop, you can go to this website. If you're a provider, you can go to this website. But if you're an individual who needs more, because what the site does not do, it doesn't provide you lesson plannings for teaching. It doesn't provide you with professional medical advice. And so people seek medical advice differently. And I'm not going to say one size fits all here. Individuals could phone 811. And for instance, we do advise people to phone 811 for the Mpox vaccine eligibility. And so they're triaged and shown where to go within the province. So if individuals want more specific questions, they can certainly call 811, or they can actually attend one of the sexual health clinics or anything that was listed, or any sites that list. So we're actually kind of a grouping of many stakeholders in this space. And whether it's about consent or sexual violence, we have services that they can go near them. So it's not one size fits all. People have a variety of ways to get their sexual health information at all ages. Is there anything else you want to tell us about or touch on before I let you go, Janice? I just want to let folks know that they can email sexlifesask at saskhealthauthority.ca if they want to become a stakeholder or they want to provide feedback to the website. And providers can actually get business cards, magnets, and posters through that email. So again, sexlifesask, Sask Health Authority, if they need more information. And we made it really easy to remember. So that way people can access it on a regular basis. But, another little tip for you, we've actually been able to help with the privacy and confidentiality. So there's actually a button on the top right corner that if you click it, it takes you right to the blank Google page. So if you're in that nursing home and you're on the computer and people don't know want you to look at something, you just click the exit button and it gets you out. Or teenagers teenagers or other individuals. So I think that is, or if you're doing the sexual violence and looking for that, certainly it's a protectiveness for folks. And I also wanted to let you know that we don't actually save personal data or usage. And so it's just unique sessions or visits. So I think people should not have any concerns about their privacy and confidentiality when it comes to this website. So take a look at sexlifesas.ca.
Oh, Janice, this was more information than I could have hoped for. Thank you so much for spending some time with us.
You're very welcome. Happy to be here.
That was Janice Seeback. She's the province's STBBI coordinator with the Saskatchewan Health Authority. And again, that website, all those resources, it is sexlifesask.ca. What did you think? What do you think of the website?
I think it's great. I think one of the things that I appreciate about it is that it is Saskatchewan based. You're right. We do come across that a lot where people are looking at resources from other jurisdictions where different things are available or approved, and then sort of they come into the clinic and there's sort of more education that needs to be done there. The one thing I would say, and the part that our education programs focus on at Planned Parenthood Regina, is that there are organizations like the SHA that are doing a great job of putting that information out there. But it's the other skills that go with that. Awareness is only one part of that behavioral, change or those things that are going to lead to the kind of health behaviors that we would like to see in the sector. And so we really try to focus on things like, here's all the information that you have about a condom and how to use it and how to put it on. Do you have the communication skills to negotiate using that condom? Has anybody ever talked to you about how to examine your own values and decide what you are into or what you're not into? And those are the type of sort of bigger conversations that I think need to go alongside some of this factual information that's out there.
Candice, am I getting old, or is sex less taboo with the younger generation and having these conversations?
I think it really depends on the person. I think it really is individually dependent. I think it's really fantastic that the SHA has such a really great tool here for folks to come get that information, find all those partnerships, find the places they can go. So, that in itself, the fact that that is publicly available does indicate that there is a little bit more of an open acceptance of sex and sexuality in terms of, public discourse. In terms of actual young people, I'm too old. I don't know what's going on with the youth. But the youth that absolutely come here and the youth that are a part of our educational programs and streams that we provide, absolutely. They are truly give me hope. They are incredibly intelligent young people who are really determined to make a difference for themselves, their relationships, their families, and their communities. It is really, I think this sexual and reproductive health as a hub itself is in a really amazing space to be, to see what's going on, to get that little glimpse from my, essentially my old person tower and look down at what's going on in the ground. Yeah, I think the youth they're so intelligent beyond ways that I ever was as a kid. So I'm really excited to see what happens with them and the tools that they have.
Talking to the three of you today has actually made me feel better about the state of sexual health care and education in our province, because you're working so hard at getting that information out and helping people. But I know you're all not without your challenges. The health region with its challenges and staffing alone is a big one. But for your individual clinics, what do you need going forward? What are your hopes for the future for your own, personal clinics and how they're doing and what you'd hope to be able to offer more of going forward if you had more money or more staff or more resources? Because I know that if you had more, you do more.
Yeah, I mean, that's a really big and excellent question. I mean, essentially, core stable funding. That is what we are after in order to continue to do this. And we're currently in negotiations right now. The ministry, we are so elated that they provided bridge funding for us this year to be able to continue those services. And we were, with that funding, the same funding, able to add a couple extra hours for a drop-in clinic. And that is also what I would like to see, is expansion of services. But in order for us to do that, in order to expand properly, you have to have a solid foundation and a solid core to make sure that you're still serving the people you need to serve, to make sure you don't overextend yourself. And what's really important is, staff burnout in healthcare is really a huge issue. And to make sure that my team feels supported financially, as well as emotionally, and is safe in their physical space, to have those anchors down in order for us to actually expand services and really talk seriously about that, which is something we really want to do. But ultimately, it is that core funding.
Julian, what about Planned Parenthood?
I'm basically just going to echo that. I think the resource environment is something that we are constantly nervous about. The core funding that we have only covers maybe 40% of our operating budget. And sort of looking at some trends that we're seeing, announcements about federal budgets, all of those things are, and I think the highly politicized way that sexual health has been talked about, it's really affecting the availability of resources that we would normally be accessing to supplement that core funding, whether that's for education programs or pilot programs, or just, to sustain what we already do. It's the whole nonprofit system really is just, yes, we can do things more efficiently a lot of the time. Yes, we can provide a lot of cost savings down the road. But oftentimes in the nonprofit sector, that comes at the expense of the people who work those front lines.
Mm-hmm. Okay, let's leave on a positive note. What is one thing that we took away from today that made us happy? Janice, I'll start with you because you're sitting there smiling.
Well, that wasn't the question I thought our takeaway was, but my takeaway certainly today is sexual health needs to be stages for all stages of life. And I think the website is so colorful and interactive, it will help. But the other takeaway that I wanted to mention is a test for one, test for all. And I think folks out there need to know, if they just come in and say, well, I need a urine sample, but perhaps urine and blood. And I've done a lot of urine and blood for my career, testing in this space. So I think my takeaway is, be informed and make sure that you tell your provider, or providers make sure if you test for one, test for all.
Julian, what'd you take away from today?
That we all need a vacation. I'm just kidding. That's not my real answer. My real answer is, that there's just a lot of people who are working really hard on the challenges that we have in this sector and in this province, from a lot of different angles and a lot of different approaches, and all of those are valuable. All of those are necessary, whether that's from a nonprofit clinic, or from the SHA, or from legislators and policymakers.
Candace, I don't have time for a takeaway from you.
I'm sorry.
That's okay. I'm happy to be in community with everyone here. It's fantastic.
Thank you, all of you, for your time and your expertise today. I appreciate it. I think our listeners got a lot out of it. I appreciate your time.
Thanks so much.
Candace Klein, Julian Weatherspoon, and Janice Seaback.